So, like, if you also here, you went from about 45 to 60. I took this thing last cycle from my second class to first class exam. And I actually did about the same. So I normally score about 45, 50, somewhere around there if I'm having a good freaking season. Like, you know, you guys already probably got told about, we take the early exam, the late exams, and how those are about the same as the previous ones. Some of those I actually scored pretty high on too, but for me, high is anywhere up in the upper 50s, right? I went to this course last cycle, one before, we went on this little track dunker pump, and it's a great course, right? It's a good thing to just have with you to reference, because you guys got the information, the instructions, you got the PowerPoints if you want to go over those, you have the quizzes, the tests, you can sit down at home and you can do this instead of just being in the classroom. What I did is I went a little bit retarded with it, right? So when I was sitting in the classroom, I had a pen and paper out and I started writing it down. Anything that caught my attention, anything that I could remember, anything that the instructor was saying, that was like key, I'd write it down. And I tried to freaking focus on that. And then I went through the exams, and when we're sitting here, all right, focus on what the instructor's saying. You listen to them. Sometimes they're good, sometimes they're bad, but you still want to listen to them, see if you can get anything out of them. But I also would, like, when we had that time, just take that exam, that test at the end of the freaking course, which I don't know if you guys do, because you're, 4 days instead of 5. I would sit there and I would do that as many times as I could, right? Sit there and 20 questions. All right, let's get 20 questions, and I'd miss like 1 or 2, and go through it again, and go through it again until I hit 100%. And then at the end of the day, we do the test, and then I go back and do like a chapter, and then I do the test, chapter quiz, test, chapter quiz. Got home and I did it again. Like I went full retard with this thing, right? And used other resources like BMR, used other resources such as what's the other one that just came out? It's got the ship. Blue Jack 2. Right? And I used those as well. So I go home and I got I got 3 kids, 2 dogs, and a wife, right? And I tell everybody, I'm like, all right, I'm not here. I'm at home, I'm on the computer, but I'm not here. I'm not taking care of your homework, I'm not doing anything. I did this for a month. Wife hated me. But I sat down and I just did it for a month, and I just go over things. And my Chief Allen, he said one thing that helped him, because he came from the same generation as we all kind of grew up playing video games, right? And then you get into video games or something that you like, and your mind starts tuning into that video game, and you start paying attention to that video game. One thing that he said is you try playing that video game and then you die, or you come to a save point, you go back to studying. I tried that a little bit too. When I took the exam, it was the highest I've ever scored. It scored at 91 percentile, which I've never done. But I picked up by 16 points. So I actually like this course, but you have to put more of your time and your effort into trying to pick up. This isn't just going to give you the answers, right? If we were able to do that, you'd have that thing on fucking Google anyways, and you'd be able to download the answers for the HM2 exam, print them off, and you just study the answers. But we don't have that. So this is a tool to use, but you have to use it as if you were planning on building something, right? You can't just use a tool like a hammer, hit something, and put it down. If you're planning on building something in your career, if you're planning on advancing, you actually have to use it to build your career, right? So we're going to get started. Does anybody have any questions? Cool. We're going to go off the HM Manual, Chapter 6. I got to go through 6 through 11 in an hour, so this is going to be fun. And if I can figure out how to use this thing. That was good. At my house. Did I do this one? No? There it goes. Cool. Anatomy and physiology, all right? Skeleton, same height. So what is anatomy, right? Anatomy is the study of the body structures in relation to one part or to another. So when you go through the exam, it's going to show you a whole bunch of questions, and those questions are going to have these words. Right? It's not going to be like, oh, what is this? No, it's going to be like the superior freaking aspect of whatever, blah, 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 blah. So identifying whatever those anatomical positions is, this is going to be your key reference. Understand that, you'll understand the question, okay? Alright, so this gives a breakdown of what it is for each one of those anatomical positions. Anterior, ventral, posterior, dorsal, medial, lateral, Those are like just, you want to know what these are. So when you go through your exam and you see that, and it works for dental too, right? Because they'll be like the distal pulp or whatever, blah, blah, blah. I hate dental. But it's one of those things that you just want to understand what you're talking about in the question so you can get at least a general idea of where this is. And maybe that general idea will lead you to the answer. All right, then we go on to characteristics of living matter. Yeah, we all know what living things are, right? So you're looking for metabolism, homeostasis. Homeostasis is the body's self-regulated control of internal environment. I have seen that on the exam. Not specifically like what is homeostasis, but asking in relation to homeostasis. The freaking organism levels of organization. You got your chemical level, right? I don't think I've ever seen this on exam. It might be different from the last time I took it. But just look for key facts when you're going through these PowerPoints. All right, I got to go through 6 and 11, so I'm just going to point out things that might help you guys, point out things that I've seen on the exam. All right, so look at key facts. So chemical level is 100 different chemical building blocks of nature called atoms. Organelle level, all right, consisting of chemical structures organized within larger units. Cellular level, cells consist of the smallest and most numerous structural unit that possess the basic characteristics of living matter. Alright, you got your system level, organism level, organ level, tissue level. Which one of these do you think is most complex? More complex, right? Keywords. So when you go in there, what is the most complex system, or most complex organism, right? Organ, most complex. See how that works? Keywords. Remember the keywords, what they're associated to? Help you out on the exam. Alright, cell. Typical cell is made up of the plasma membrane, nucleus, nucleoplasm, and cytoplasm. I've seen this one on the exam. Important in the cell's reproduction, due to storage of genetic information. Alright, so just understanding what these are, why they're different from each other, key facts, tells you what it is, gives you an idea of what the answer is. Types of cells, simple or undifferentiated cell. Just just for your guys' information, I suck at pronouncing stuff, especially if it goes past like 6 fucking letters. So you're gonna see me kind of like stutter on some of this stuff. Alright, simplest living organism consists of a single cell, able to carry on all processes necessary to life. Multicellular organisms, cells varying in size, shape, and number of nuclei. Alright, there's a picture. You will never see this on the exam. Alright, but it gives you a breakdown of what this is, so it can give you a general idea of where to find these things. So some of the stuff that I've seen is going to be chromatin, nucleus, and it's going to ask you, what does the nucleus do? What is it for? What's its function? Right? So if you can identify where it is, maybe you can identify its function. Alright? That's a pretty picture. Alright, now we're talking about cell shapes. Simple, stratified, so kind of how the building blocks are put together. I'm not going to try to pronounce any of these. Well, I can do this one. Columnar. I can't do it. Alright, so basically you guys understand what this is. These are cells, right? And then depending on what type of organ tissue it is, depends on how it's built, right? And the different levels of it. Epithelium, lining tissue of the body. What do you think the lining tissue of the body is? Alright, tissue cells with many layers are said to be stratified. Keywords, stratified. Cells with many layers, stratified. Goblet cells. This is what they look like. Alright? I don't know the function, so let's figure it out. Nope. Alright. Simple columnar, whatever the hell. Epithelium, photomicrograph, and simple whatever the hell. I can't even say that. Sorry, like I said, 6 letters. Alright, connective tissues, supporting tissues, various structures of the body. Connective tissues composed of cells and stuff and everything else, but it doesn't really go into it. Adipose, fatty tissue. There's a key one right there. Osseous, bone tissue. Alright, voluntary muscle fiber is, I said that word 2 minutes ago, striated or striped, and is under the control of the individual's will. All right, so voluntary muscle. Give you some more pictures, give you something to kind of identify. So I think I've seen one of these in an exam one time. That was way back in the day. I think it was before the D test came out. So cardiac muscles, dark brands. So you can see the difference between the different types of muscles, right? Smooth muscle tissue over there. Cardiac muscles, a little bit more dense, dark bands. All right, nerve cell. So neurons, basically nerve tissue. So you can see the picture, right? Nerve cells don't look like normal cells, kind of spaced out and connect to each other. I saw something in here. Yeah. Axon. That's what it was. Axon. And I can't remember if it's described. So epidermis made up of tough, flat, scale-like epithelial cells. Dermis, your skin. This is just really a whole bunch of information, so you go back and look through it if you want to. Keywords though, remember that. The skin contains 2 types of nerve fibers, motor and sensory. Those are your nerve fibers. Smooth muscles, where you think smooth muscles are. Involuntary muscles, more like your heart. Smooth, or those cardiac are smooth. Skin appendages, sweat glands, ceruleans. Alright, so tissues are 4 specialized groups. You got your epithelial, outer cover, connective, supports the framework of the body. Muscular, provides the body with movement, and nervous, most complex. Alright, the skin is the largest organ of the body. It consists of 2 basic layers, the epidermis and the dermis. Let's see. There we go. Skeletal system consists of 206 bones. That's going to be in your freaking exam. Compact bone is hard outer shell, cancellous tissue, interspongiporous portion of the bone. All right, so we're talking about the bone system right now. All right, 4 bone classifications. You guys know those? Long, short, flat, and irregular. All right, so I haven't seen a whole lot of questions like this before, but I believe when you go into more of your like TCCC or your first responder type questions, they will ask you like, this is long bone, you freaking splint, blah, blah, blah. So just recognize long bones, your femurs, humerus, and stuff that doesn't have another running bone with it, or it's going to be in like, you're not going to have it inside your thoracic cavity, then it's a long bone, so it's going to be a humerus, so it's going to be a femur. So do you splint that? Yes, you can splint it, but like femurs and traction, blah, 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 blah. A lot of things that you can think of when you're talking about certain subjects. So axial consists of 3 parts: your skull, vertebra, and thorax. Right? Skull, vertebra, thorax. 28 bones in the skull create the framework of the head. 28 bones, right? That's key. That's going to be on your exam. Vertebral, 24 movable true vertebrae. Thoracic is going to have the 12 vertebrae in it. Appendicular consists of 2 parts. You have your upper extremities and your lower extremities. Everybody get that? Upper, lower. Circulatory, also called the vascular system, consists of blood, heart, blood vessels, 2 types of blood cells. You have the red blood cells, and what do you think the next one is? White blood cells. Doesn't say it on there. More like leukocytes. 2 things in here. So, lives in the body for 100 to 120 days. I don't know if it breaks it down into where red blood cells are made, but hopefully you guys know. Most of them made in the bones, and I believe there's a new study out that actually the lungs function important too, but I don't think that's in the book. Raised to 15,000 to 20,000 for your white blood cells or your leukocytes for higher during an infection period. So, what do white blood cells do? What do red blood cells do? It's kind of things you need to look for. And then the white blood cells breaks down into how many different categories. and then know those terms too. Pericardium, membrane sac enclosed the heart. Pericardial fluid that lubricates the heart. Pericardium, endocardium, serous membrane lining of the heart, and then myocardium, heart muscles. So if it starts talking about pericarditis, what is pericarditis?
Inflammation of the sac.
Alright. So I know that one's on the exam. I've had that a couple times. The only way I knew that one was because my friend had it. Just, you know, life experiences also help too, right? Arteries and arterioles, distributors, capillaries, exchangers, veins and venules, collectors. Immune system has three defenses, right? You have the first one, your stomach, your skin, your tears, your urine, your sweat, mucus, saliva. Your secondary is going to be inflammation in affected area. Why? Because it's trying to break it down, trying to beat it. The third one is going to be antibodies and memory cells, or your immune system. Nervous system rapidly transmits impulses from on area of the body to another. Now, from one area of the body to another. Endocrine system works at far slower pace. Keywords. Nervous system rapidly. Endocrine system slower pace. Which one's faster? Right. Respiration is exchange of oxygen and carbon dioxide between the atmosphere and the cells of the body. There's two phases. You got your physical, mechanical respiration. You got your physiological respiration. Physical. I'm breaking. That's the last one. That's the last one. Then it's going to have questions. Anybody have any questions on that? Did I run through pretty fast? What's up?
One point on test is, the question was, what view is horizontal to both sagittal and proximal view?
I was going to scroll back at that.
No view.
My bad. So open up PowerPoint. Anatomy and physiology. Cool thing, my daughter just got one of her baby teeth pulled out because one of the roots just kind of like disintegrated or absorbed into whatever, a little bit too fast, and became grew a cavity in there, down near the gum line, and became abscess. So we just ripped that fucker out 2 days ago. Pretty cool. They got to sit there and doctors all like doing their thing and showing the x-rays. I thought it was interesting. Like I said, I don't really like teeth that much because I don't really care about teeth that much. So, growth period. Dental development usually begins in the 5th to 6th week of prenatal life. 7th week, epithelial skin cells tighten along the jaws, creating the worst shoe-shaped band called the dental lamina. Sounds Spanish. The total growth period is divided into the bud cap bell stages. So usually 10 tooth buds are presented in each arc of the form primary teeth. Tooth buds for permanent teeth form between 17th week of fetal life through 5 years of age. Except my little daughter. Sorry, get her big teeth in. Yeah, she was high as a kite. It was actually quite fun. Alright, so cap stage, also known as the proliferation, reproduction, and multiplication. Bell stage. The final stage is also known as the big ass word. Let's see if we can say it. So differentiation. Differentiation. I will not say that again. I swear I won't. Alright. Ameloblast cells from the enamel, odontoblasts cells from the dentin, whatever the fuck, cement blast cells from the cementum. See, it makes you guys laugh, make you pay attention, maybe you'll remember this stuff. You're like, that guy was an idiot, I remember that. Alright, morphodifferentiation, process of tooth taking shape, calcification, the process in which organic tissue becomes hardened by deposit of calcium or any mineral salts. Eruption, movement of the tooth into its proper position into the mouth. Eruption, right? Smacks it straight up. Oh my god, my baby's got a tooth. Right? Eruption. Not. Alright, exfoliation, shedding. The root of the primary tooth reabsorbs, looses structure, and then permanent tooth erupts from the jaw. So what happened to my daughter? Just happened a little bit early, back molar. Just one half of the freaking root. Right? Exfoliated. It sounds weird. Like, let me see your tooth, I'm gonna exfoliate you. Alright, the tooth is divided into two parts. The crown, one or more roots. The crown is divided in anatomic clinical crown, right? So this is your tooth, that's the root, cervical line. This right here, sorry. Apex. So the root is covered by the cementum embedded in the thin layer of compact bone that forms the tooth socket. The tooth may have one or more roots, hence front, back teeth. When the root has more than one root, the regain where the root separates is called the frication. Alright, the tip of each root is called the apex. Boom, apex. Tip of each root, apex. Tiny little point. Got it? Good. So this is that trifurcated maxillary molar. 1, 2, 3, bifurcated. Learn. Buy and try. Alright. Enamel is a calcified substance that covers the entire anatomical ground. Color may vary. Hardness of tissue, approximately 90% inorganic materials, minerals, whatever. Dentin, light yellow substance, harder than bone, less dense than enamel. That's actually on my exam. Approximately 7% inorganic, 30% organic water. Bone-like tissue that covers the roots of the teeth, cementum, joins the enamel after the cervix of the tooth, forming CEJ. What do you think it stands for? Cementum enamel joints. Junction? Got it. Alright, soft tissue inside the tooth. See, you gotta learn from each other, I'm learning from you. The pulp chamber contains the dentin pulp, right? So this is a really cool thing. Is one of you guys a dental tech? Boom. That's why I keep hearing this stuff. You're so smart when you're dental. Alright, so enamel, right? So cavities form. And then once they go through, what is it called? Cavities go through into the dentin. Isn't there a word for that? When the cavities penetrate into the dentin and they go into the root? Just the hole? Okay. Just the hole. It's a hole. You got a giant hole in your mouth. Alright, so bony portion of the maxilla of the mandible where the teeth are embedded in the tooth and supported, blah, blah, blah. I wish this would cut off because I want to know what this is, but alveolar something. There's a hole. Alright, so this is the periodontal ligament. Attaches the root of the tooth to the bone. So knowing the breakdown of your tooth, right? You got the cusp of your tooth, the enamel of the tooth, dentin, which is the inside of the enamel. So enamel on the outside, dentin on the inside, and then you get your pulp. Pulp's on the very inside. It has the blood vessels and the nerves, right? blood vessels, nerves, dentin, and enamel. Cementum is down here. It covers a thin layer down through the roots. Apex. Okay, figure out what the apex is. Alright, the crown of the tooth, the roots of the tooth. So things you're going to see, which I've seen on the exam multiple times, which layer is dentin, which layer is enamel, pulp, cementum, what is function. So know those like the main big blocks of the tooth. You should be able to fucking have a better educated guess on your answer. Oral cavity is covered by oral mucosa, which is in 3 parts. Masticatory mucosa, lining mucosa, specialized mucosa. Masticatory. Wow. Man, wouldn't they just figure out like this is A? A, B, and C. Okay, covers the alveolar process, firm and resilient, circles around the neck of the tooth, protects the alveolar process and the periodontal ligaments bacterial infection. You guys don't want to hear me read all these. Unattached gingiva, also known as a free gingiva. Alright? Gingiva marginal, 1 millimeter narrow band that forms a medial collar around the base of the tooth. Gingival succulus. Saltus? Am I saying that right? Yeah, wooden stuff. Who's got a picture? Alright. Area between the attached gingiva and the tooth. Popcorn holes get trapped in this area. That's why I need rid of stuff, right? Alright. Let's go on to dentin. I like dentin more. Normally humans develop 20 denticus. Don't have to be anti-Semitic. Anyways, 32 permanent teeth. Dental arches. Someone got the joke. Alright, dental quadrants. Right, maxilla, left maxilla, right mandibular, left mandibular. Each quadrant contains 3 anterior and 5 posterior teeth. There we go. Cool. Alright, this is important right here, to a point. Also knowing the numbers. So, since you're a dental tech, where do we start with 1? Top, right? So it's top right molar. Say this is top, this is bottom, so top right. This says third molar. Alright, so anyways, third molar, second molar first, second bicuspid. I'm sure it's counting from the center and going back out. But also the counts of the teeth, I'm pretty sure you're right. Because I remember it on the right side. It's the top.
It's from the top right, and then it goes all the way over here to the left, and then it jumps down to the bottom and comes back the other direction.
So remember that, because that's actually important to see that on an exam. Which number is this tooth, or whatever the case may be. You can sit there and literally count the freaking teeth out.
And your I think it's the dental, I think I'm wrong. The wisdom teeth don't count.
They count just for dents, but if you don't have them, you usually, oh, it's 1, but it's actually the wisdom teeth is 1. So even if you don't have them, it's still 1.
I'm going to remember to get the teeth pulled in boot camp. That sucks. Alright, so 1 on the right side, right? And then it goes all the way around, drops down, goes all the way around. So if you guys can remember that, if you ever had that question on this exam or your next exam, you'll be able to hopefully answer that. Incisors using incised cup food. Cuspids have 1 cusp. Bicuspids have 2 cusps. Molars, bicuspid, 2, cuspid, 1. Got it? Cool. Molars, 3 different molars. Alright, the primary teeth are identified alphabetically, A through T. Permanent teeth are identified numerically, 1 through 32. So there's 32 teeth in your head, unless you're weird. Here we go. Starting with the right side of the maxilla, last molar, 1. Moving to the left side, 16. Then you go down, that's 17. All the way back up around 32. So we just pre-gamed it, right? We just did it a little early.
Oh,
yeah. Alright, 1, boom, 16, down to 17, boom, all the way up to 32. Everybody remember that? Cool. Alright, facial, mesial, whatever. Distal, lingual, oculosa, whatever. Alright, like I said, anything past 6 letters. Alright, we're fine. Postural surfaces, 2 surfaces. Just stop this, man. This is wrong for you. See, I'm all nervous, right? Facial, occlusal, mesial, distal, and how do you say that? Nothing mesial. Mesial? Mesial.
Like little.
Got it. It's like French. Alright, the relationship between the maxillary and the mandibular teeth when they make contact, occlusion. I guess I read the next one. When an abnormality in occlusion occurs, it's called a malocclusion. Malocclusion, abnormality in occlusion. Interesting. Made up of two arches, right? Curvature Reed and curvature Wilson. Curvature Wilson. Basically, the angle of your teeth, right? You should know this, right? You make teeth, angle of the teeth. Yeah. Dental Texas, swear to God. Angles classification, class 1 normal, class 2 deficient in chin length. I'm not going to pronounce that. Class 3 excessive in chin length. Right, so class 1 normal, this person looks like he'd go and be a model. This guy looks like he'd be the bad guy on a TV show. Class 3, no, he's the bad guy. This guy's just the weak guy. All right, so class 1's the normal, he's the hero. Class 2, he's the weak guy. Class 3, he's the bad guy. Now you just gotta remember what those things are. Angles classification. I think that was it. The last one. Remember these things have a question on the end? Let's switch over to the next one. So we're going about 10 minutes per slide. I'm going to go over my time.
You mean next slide?
Yeah.
You know how to pull it?
I have no idea what I'm doing. Apples. Any questions on teeth? You can ask them.
Right, so yeah, I have a degree plan for that program already. So you have English Composition 1 done, scratch that off on credit. You have College Algebra 1, Intro to College Math, scratch that one off. You have undergraduate history done, scratch that off. Science, you have like NP, science of everyday life. Like science facts of that. So if you
But it's really important. If you guys want to pick up, you just go over these. It's not the answers for the exam, but it's close to, or gives you an Alright, y'all ready? Push on? Cool. That's the tongue. Oh, we got mood lighting on this thing. Alright, cool. What is oral pathology? Science that traces the nature, cause, and development of oral diseases. Alright, so salivatory glands can secrete about 1,500 milliliters of saliva daily. That is kind of gross. So I wonder what happens if we add that. Probably a lot more. I can spit up a lot. Alright, there are 750 million microorganisms per millimeter of saliva. That's disgusting. Alright, the temperature in the mouth is 98.6 degrees, roughly. The mouth is perfect for harboring bacteria.
Yeah.
Mood lighting. Oral pathology. Alright, what is an abscess? Abscess is a localized collection of pus in the area of the bone or soft tissue, commonly caused by an infection. Alright, how do you get that infection? Because you have some kind of bacteria that intrudes into some place where it's not supposed to be. Cyst, enclosed pouch sac containing fluid or a semi-solid material. An ulcer, disruption of superficial covering the mucosa or skin by biting, irritation, toothbrush injury. Oh my god. toothbrush or a virus? How? You gotta really think about that one. How do you injure yourself with a toothbrush?
Brushing the wrong way.
Right. Using the other side of it. Alright, the two most common elevated lesions are vesicles, small elevation that contains, small elevation that contains fluids, and hematoma, localized collection of blood, escape blood vessels due to trauma. Alright, so getting punched in the mouth or just getting something stuck in the mouth. Alright, the two most common non-elevated lesions are Chia? No, I don't know what the hell that says. But it's a round pinpoint, non-raised purplish red spots caused by mucosal dermal hemorrhage. Alright? And then you got your, whatever the hell that one is. It's got too many freaking letters in it. Large purplish red areas. How do you say it?
Ecchymosis.
Ecchymosis? Oh, yeah, okay, now I can see it. Large purplish red areas caused by blood under the skin area that turn blue or yellow. Yeah. I don't want a blue mouth. Dental caries. Where are dental caries? Cavities. Just call them dental caries because some want to be fancy. Alright. Disease caused by microbial process that starts on the surface of the tooth and leads to the breaking down of enamel, dentin, and cementing. In some cases, it causes pulp exposure. Right? So what do we do after pulp exposure?
Root canal.
Root canal. Just like, oh man, he's learning. That's great. Thank you. Alright, the process that destroys the tooth is called decay. Dental caries are also known as cavities. Good lighting is true. Alright, the first step in the decay process is decalcification of the enamel. Alright, and then once the decalcification of the enamel, then bacteria goes in, bacteria starts breaking down everything else. Here's white chalky spots on the tooth. Alright, and on X-ray, it's dark spots. She's like really proud of me right now. Alright, decay has been linked to Streptococci and other acid-producing bacteria in the mouth. White breast stings. Alright. Lesions. Now we're talking French. That's definitely French. Alright, surface area that hasn't progressed past the decalcification stage. Arrested lesions, decay spreading in the enamel, blood reaches the stopping point. Recurrent caries, decay process that occurs underneath existing dental restorations. And smooth surface caries, development in proximal surface or interproximal surface of the tooth. So basically, look for the key facts here, and you're probably not going to hear all of these in there, but I have seen lesions, caries on the exam. Maybe they changed up the words, maybe they changed up what this is, not changed up what it is, but maybe they changed up the questions and asked differently. Instead of saying, what carie does this, what is this kind of carie, right? Dental pulp is living tissue composed of vascular connective tissue, blah, 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 blah. Well, I can speak. I'm just talking to you guys. I'll do this. Alright, microorganisms enter the pulp, produce damage, and build pressure in the canal. Pain is dull ache that can lead to more severe pulsating pain. Very simple abscess, what we're talking about, by the way. Inflamed pus like abscess forms in the pulpal now. Another little thing on this one, very simple abscess. Bone loss around the apex of the tooth. Remember the apex? Top or bottom, depending on which tooth you're talking about, right? But the very end of the tooth, right? Alright, what is necrosis? Death. Alright, necrotic teeth must be treated. Can't leave them in there, right? Gotta take them out. Dead. Hey, teeth. Old job. Pathology of periodontal. Alright, periodontal disease is the most prevalent chronic disease of humankind. Symptoms of periodontal disease: bleeding during brushing, tender red swollen gums, seeing gingival tissue, tooth shifting, elongation, mobility, purulent discharge, abnormal fit, and dentures, and halitosis. What are we talking about? Oh my God. Gingivitis, inflammation of the gingival tissue. Marginal gingivitis, most common. Wait. Keywords? Most common. Marginal gingivitis. Main characteristics are swelling, loss of stripping attached to gingiva, redness, easily contractile, succulus, whatever, and tendency to bleed easily. Necrotizing ulcerative gingivitis, node. I've actually seen that one. It just said, what is node? Necrotizing ulcerative gingivitis. Referred as trench mouth or Vincent infection. Wrong way. Node. Remember that one. I've seen that multiple times. Alright. Periodontitis, chronic inflammation condition that involves the gingiva, crest of the alveolar bone, and periodontal membrane. Loss of supporting bone, periodontal pocketing, and increased mobility. That's not a good thing, right? So, it means your tooth is loose. Alright. Bluish red gingiva recession with progress as disease progresses. Recurrent aphthlostomitis. I think I said that right. RAS. Alright, cool. Also called canker sores, are painful ulcerations found in the vocal mucosa, tongue, soft palate, and the floor of the mouth. So this one I have seen, I just haven't seen this. Canker sores, where they affected found, basically. Healing is usually 7 to 10 days. Herpes, type 1, oral herpes. HIV is the main cause of acquired immunodeficiency syndrome. Why is this two? Both threats to all dental health professionals and other healthcare workers that are exposed to body fluids, blood and blood products, instruments, and equipment. Basically, it's just viral infections. HIV infections. Oh, you've seen this one. If you haven't seen this, look it up on freaking Google. That's nasty. Shit's all weird and hairy. Alright, oral cancers found most often on the tongue, floor of the mouth, and upper lip. How do you get cancers? How do you get oral cancers?
Chewing tobacco.
Chewing gum?
Chewing tobacco.
I was saying chewing gum? What? That's new. Dip, right? Dip's a main proponent to oral cancers. There's a lot of people that dip here, right? You should probably look up what that is. Benign tumors, non-life-threatening. Malignant tumors are life-threatening, left untreated. So remember these two right here. Benign, non-life-threatening. Malignant, life-threatening. Alright, so some of the things you can have, carcinoma, adenocarcinoma, sarcomas, right? Affects the supportive connective tissue of the jaw. And then snuff is actually tobacco. I don't know why. These are things found in your mouth. This is not, unless you put it there. Snuff, nipper's patch, smokeless chewing tobacco, or snuff plays a role in these precancerous lesions. Identified by a white scaly patch called leukoplakia, or snuffer's dip protosis. Irritation, blah, 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 nicotine smokers. Alright, congenital disorders are present at birth, such as these. I'm not going to say them. Anodontia, supernumerary teeth, cleft lip, cleft palate, and I'm not going to try that. Who knows what cleft lip looks like? Alright, cool. What is the other one? Cleft palate. Alright, results when the palate shelves right, left, don't fuse, leaving space. That's actually dangerous. Imagine sneezing cleft palate. Where teeth are blocked by physical barriers such as teeth, bones. Alright, impaction can cause tooth erupt horizontally, vertically, in a normal position. Remember, tooth eruption doesn't mean it means, right? Sound effects. Awesome. Yeah, mood lighting and sound effects. Alright. Attrition, wearing away of the tooth caused by tooth on tooth, which is you can get from grinding your teeth at night, stuff like that, or just eating metal for some reason. Abrasions, loss of tooth structure, secondary to action of external agents. Alright, erosion, loss of tooth substance, a chemical process that does not involve bacteria. Any questions? Cool. Very good. Go over when you look at your breakdown on your last exam. Most times you'll have some kind of prep medicine block in there, right? And then you look at how many questions that prep medicine block was. It's usually, I think, around 12, 13, 15 questions for prep medicine block. Maybe it's a little bit less on your guys'. That's kind of the thing you need to pay attention to. If it's got more questions, then it's kind of stuff you need to study. You can get kind of like a history trail if you go back and review all your exams on your profile sheets, look down at the bottom, see how many questions were asked for each subject, and then to better your chances, start studying the things with the higher numbers, right? I love it when I study like BMR and I look on there and it's like 3 questions from BMR. So. Alright. Sanitation. Hygienic means promoting health and prevention of human contact with hazardous waste. What is hazardous waste? We're talking about preventive medicine with hazardous waste.
Anything that can harm.
Waste, right?
Yeah, but there's a definition for it.
So basically, what I'm looking for, not really a definition, I'm looking for what is hazardous waste. So blood, urine, poop, human body fluids, right? That's hazardous waste. Anything that contains that, hazardous waste. Alright, a bacteria in the animal capable of transmitting pathogens producing human or animal discomfort or injury. And roaches. Okay, no, not really. Alright, more of a pest. Anyways, pest, organism that adversely affect military operations, well-being of man and animal, attack real property, supplies, and equipment. Alright, foodborne illnesses represent a threat to the health and morale of the military personnel. So just to break these up, right, what's a vector? An animal capable of transmitting pathogens. So we're talking about like mosquitoes, right? Mosquitoes transmitting pathogens. Some of the pests, like your rice weevil, your frickin' German cockroach, stuff like that. Those are they're pests, but some of them can also be vectors, right? Depending on where you are, what they are doing, where you found them. Alright, susceptible hosts. Diseases that may be transmitted from carrier to susceptible host, transmitted directly from an infected person to animal, or indirectly through intermediate host vector or inanimate objects. You imagine that paperweight action. Alright, asepsis. So these are terms for the prep medicine chapter. Asepsis, state of being free pathogenic organisms. Aseptic technique, trying to keep the pathogenic organisms out of whatever the hell you're doing. Bioburden, the number of microorganisms containing an object. Bloodborne pathogens, pathogenic microorganisms present in human blood. Boyd-Dick type test. Diagnostic test for pre-vacuum, sterilized stability. Chemical disinfection, destruction and inhibition of most viruses and bacteria while in active growth phase. Chemical indicator, chemical dyes. And they're going to go over all this again, so this is great. Contamination or contaminated pressure, presence or reasonably expected presence of blood, potentially infectious material, contaminated laundry, really. Culture, reproduction or growth of microorganisms and living tissue cells. Dental item classifications. Is it critical, semi-critical, non-critical based on pathways? Basically how it can get contaminated and how you can cross-contaminate. Anyways. Critical items, instruments, materials that penetrate skin. Semi-critical are instruments, equipment, and materials frequently in contact with mucous membranes. Non-critical are instruments, equipment, materials that do not normally penetrate or come in contact with mucous membranes. So that hopefully kind of broke down some things. Like remember what I said at the beginning, key facts, right? So critical, penetrate skin. Semi-critical, mucus, non-critical, not normally penetrating or touching vehicles. Right? Just look at those. Nosocomial infections, an infection resulting in treatment in a hospital. Right? Nosocomial infection in a hospital. Nosocomial. Occupational exposure, saturated steam sterilization, sanitary sewer system. Spray, white spray. It's a type of sanitation method. Sterile field, sterilization area, sterilizer, antidotes, I'm literally saying this so you guys have time to actually look at it. I'm not sure who it is. Alright. Bacteria in the spore state remain alive. Alright, classification of microorganisms. Bacteria in the spore state remain alive but passive. Resilient to effects of heat drying of most bactericidal chemicals. Viruses, microorganisms are much smaller than bacteria. Viruses cannot live long or reproduce outside the host. So the difference between bacteria and virus. This one I've seen before. What are those? A single-celled animal that does not have a rigid cell wall. Alright, so there's two types of skin harbors. There's resident flora and the transient flora. Those are more or less likely mentioned at least. Just kind of familiarize yourself with this stuff because I've never seen this one. Who knows what PPE is? Personal protective equipment. Airborne precautions. Sorry, I just can't read from this side for some reason. Alright, so this is basically transmission-based precautions. You got your airborne precautions. So everybody's seen those isolation rooms, right? Put a patient in the isolation room. Usually they have either airborne or droplet precautions. And the droplet precautions, you gotta gown up and do this all crazy stuff and walk in there like Darth Vader. Alright, 3-foot partition should be maintained, so basically 3 feet away from the patient for a droplet precaution. Contact precautions, basically you just don't want to touch them with your open hands and then go touch them on other things. You can have gloves on, so you want to dispose gloves before you start touching everything else and you have to sterilize. Alright. All personnel providing direct patient care who are potentially exposed to blood and saliva must receive HPV vaccine. All active duty healthcare personnel will be tested for HIV every 2 years. TB testing and screening on an annual basis. When's the last time anybody's been TB tested? So you know we all get screened now, right? Alright, infection control in the treatment rooms. Concurrent disinfection. These are some that I always get messed up on. What is concurrent disinfection? Daily measures taken to control spread of pathogenic organisms. And what is terminal disinfection? Measures taken to destroy pathogenic organisms remaining after patient discharge. So daily measures, concurrent, terminal, after patient discharge. Seen this one, which is weird. At the beginning of each day, water line units should be flushed for at least 1 minute and then 30 seconds between patients. I don't think anybody does that. Totally worried. Patients must never use their hands to dispense items of cold storage. Kick it out the door. Patient contact areas and any other used equipment shall be wiped down between every patient. Mops, this is a good one. Bleach is a 1 to 100 dilution for EPA registered disinfectant detergent for when you're mopping. Mops supposed to clean every 24 hours. Yeah, everybody laughs at that. That's not my favorite mop. Alright, so this might be somewhere, maybe on your exam, be something to kind of remember. So exposure incident, so you got a needle stick, right? They're probably gonna ask more or less likely, like, do you squeeze the area around the skin? Do you not squeeze? Or it's gonna ask you, what do you do after an exposure stick? And give you 3 or 4, it's gonna give you 4 options of what you do not do. But in an exposure incident, apparently we squeeze the skin around the needle stick to expel the blood and contaminants. For some reason, it's sticking in the back of my head. I've never seen it somewhere before, so. Alright, so here we go. Examples include for management of infectious waste. We got sharps, needles, scalpel blades, microbiology waste, culture stocks containing microbes, pathological waste, human tissue, body parts, liquid waste, blood, whatever else, spinal fluid, cerebral spinal fluid, and medical waste from isolation rooms. Alright, and this is, oh my god, I know this is somewhere. There's like a category. It's, where is it? There's an instruction on this. It like categorizes them. Yeah, regulated medical waste. Right. I actually had a ditty for this. Brown has a ditty, and it's actually really hilarious, inappropriate stuff. Anyways, infectious waste should be placed in label with universal biohazard symbol and the word biohazard on it. Bags must never be overloaded. Should be double bagged and secured. That one's probably gonna be on there, double bagged, right? Apparently, we use the scoop method when we're recapping needles, and infectious waste without refrigeration, no more than 7 days. With refrigeration, anybody know that one? If you are storing infectious waste with refrigeration, how many days?
That was 7 days.
No. 7 days is without. 28. So surgical hand scrub for consideration is approximately 6 milliliters in a separate detergent, running water, lather hands 2 inches above the elbow. Alright. 2 inches above the elbow. And this is how we take off the gown. You put one on. These are your gloves. Who's ever used the sterile technique to put gloves on before? Hopefully they're right.
Not heard anything yet.
For people like, oh fuck. I don't think we got one more. Any questions on that? No more pictures. Right. All the Alright guys, we're almost done. I got 2 more chapters to get through. Sorry it's taking so long. I'm trying to make sure that, at least 5 minutes. Hey look, we're back on sterilization. I'm literally going to have you guys read off the sterilization techniques and times and temperatures. Alright, let's get back into it. So we're still in sterilization and disinfection. Alright, concerns transmitting the HPV virus and HIV can cause healthcare communities to become crazy. That's not the right word. Become more aware of needing to disinfect and sterilize. Alright. So disinfection is less lethal process than sterilization. Which is funny if you really think about it, because if you're gonna sterilize someone, that's fine. Disinfection is achieved by either chemical or heat beams, following same criteria, and the list goes on and on and on, which I'm not gonna let you see. I don't know how to get there. Anyways, the EPA, Environmental Protection Agency, everybody knows who they are. Has anybody ever seen someone from the EPA? That's a good question. No? Yeah.
They're not essential.
Yeah. Level of bacterial activity, right? Bacterial spores. I can't read any of that crap. But it's a high or low level of bacterial activity. Right, so maybe it's a little bit clearer, like lipid viruses, non-lipid viruses, tubercle bacillus, and vegetative bacteria. Vegetative bacteria. Like in vegetables. Bioburden, the higher level of microbial contamination, the longer the required exposure to the disinfectant is needed. So basically, if it's really saturated with crap, then you really gotta sterilize it or disinfect it. Alright, disinfection. General categories of liquid chemical agents, four most commonly used. I'll give you three. Nope. Oh, I'm messing it all up.
Maybe base solution.
The fourth one's underneath, you can't see. Alright, disinfection. Alright, so however you pronounce that, solutions of several available formations differing in pH, concentration, exposure times. Classified as high-level disinfectant. Down below, direct contact skin can cause tissue damage. 2 to 3.2% are FDA registered. Alright, chlorine dioxide solutions, high level disinfectant, semi-critical items. What was semi-critical again? Coastal instruments. Alright, rapid action of 3 minutes, disinfection of 6 hours for sterilization. Must be discarded daily and has only a 24-hour use life as a sterilant. Iodophores, classified as intermediate level disinfectants. Should not be used on white or pastel vinyls that are subject to staining from repeat exposure to iodine. At high temperature, iodophores can be unstable. Ooh. Pyro. Anyways, phenolics, intermediate disinfectant. When diluted properly, they are used for surface disinfection. Useful on metal, glass, rubber, and plastic. This gives you just a quick breakdown. This would be a good thing to just put in your little knowledge book. Right, it tells you degrees and what it's used. Right, so is that a good? I think it's a reading contact, whatever. Anyways, and then it tells you the dimensional exposure to use it for. Semi-critical requiring chemical disinfection. So we're talking about mucosal items, right? 3-way syringe tips, high volume evacuation, saliva ejector tips, and radiographic positioning devices. So we're talking all dental craft. Non-critical requiring chemical disinfection. Dental delivery system, chair unit, light portable dental units, surgical table chair, x-ray apparatus. This should be like disinfection, should be done daily after every patient. And I'm sure there was more red thing right underneath there too. The highest level of contamination control is sterilization. These are emulsions, completely annihilating everything. Sterilization process normally takes place in the CSR. Management of contaminated instruments. Do not rinse, scrub, or unnecessarily handle contaminated instruments or materials in the MTR, medical treatment, whatever fucking thing, and then dental treatment something, or other patient treatment areas. Only the CO or infection control officer can make. There's more underneath that. I don't know why we can't see it. Oh yeah, this is the one. Alright, cool. Sterilization. Automated washer, processor, ultrasonic cleaning. 3 different types. Manual scrubbing too. High risk contamination and injury. Manual scrubbing. Wrapping and packaging. Most common wrapping materials: paper, plastic, nylon tubing, and cloth. Ever do the following. Alright, so paper plastic peel packs, there we go. Fuck that up. Have a 30-day shelf life to 180 days. Alright, that one I've seen before. I don't think it was on your thing. The freaking cloth non-woven wraps are sealed with external indicator tape. Change the color when exposed to sterilization elements. What color does it change to? You don't know? Black? I think it's brown. Ensures, they're used to ensure sterilization. We're going to get into it here in another couple slides. Shit, it says 3 now. Alright, so wrapping method. Paper plastic peel packs, 30-day shelf life to 180 days. Paper envelope, okay. Paper envelope sealed with sterilization tape, 365 days, 1 year. Non-mobile blue wrap, 30 days, blah, 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 blah. Paper, here we go. Peel plastic packs, heat sealed or sub-sealed, 365 days. Someone's not following me there. Alright, sterile stands for free form or the absence of all living organisms. What the? Listen, guys. Alright. Autoclave system, most dependable, economical. What is the downward displacement? How hot do you need to go?
245.
Free vacuum steam sterilizer. Pressure user is steam too.
250 degrees Fahrenheit.
Or 121 degrees Celsius. That one I know is on the test. What is the Bowie Dick test?
Just for a vacuum.
Alright. Dry heat sterilization. It's 320 to 345 Fahrenheit for 90 minutes. So, sterilizing items, blah, blah, blah. So, these are your general temperatures, right? So, general temperatures, I guess, right? Since the temperatures increase, sterilization time may decrease the quantity of practical sterilization. Yeah. So, minimum of 250 degrees Fahrenheit, 121 degrees Celsius, 30 minutes, or if you bump it up to 273 degrees Fahrenheit, you go down to 10 minutes. So just giving you kind of a basic of, if you increase the heat, what's the sterilization time? Alright, so we're talking about chemical vapor sterilization. Sterilization requires 20 to 40 minutes at 270 degrees Fahrenheit, 20 psi. Advantages to using this chemical vapor: there's no corrosion, rusting, or dulling since water content is like 50%, and instruments are dry at the end. It's like people just forget they're in there. Right? Sterilization: use plasma state hydrogen peroxide, reserved for items that cannot be sterilized by steam, non-absorbable materials. Alright, sterile sterilization operating cycle. Get the vacuum stage, the injection stage, the diffusion stage, plasma stage, then one more stage. It says down there, it says
Vent stage.
vent stage. Hey, we figured it out. We can do that now. Alright, cassette holds 10 cells. You know what that is. After 10 cycles, a message will print out. Insert new cassette. Does anybody know what that one is? What the cells are? Has anybody seen that before?
It's the spaces that are inside the cassette for the instruments.
You done sterilization before?
No, I work on the unit.
Ah. Blocks material gas relatively low temperature sterilization. Using a heated unit, sterilization can be achieved within 3 to 12 hours at 100 degrees or 120 degrees Fahrenheit. I feel like Vanna White. Alright. Critical items that require sterilization: handpiece, burrs, diamonds, endodonic files, and gates, gilded burrs. I don't know what those are. Further information can be found in the Med Instruction 6600.10. Effective preferred method of sterilization: steam autoclave, dry heat oven, chemical vapor, ethylene oxide. Okay, so 3 commonly used sterilization monitors in the Navy. So we're talking about actually looking to make sure it's sterilizing correctly. So we got your physical, which is looking at and recording the freaking gauges or the chemical internal, external, basically like strips or whatever that change colors to tell you if it's been sterilized or it's been enough time to sterilize. Internal indicators, chemical dyes change color when exposed to steam, dry heat, or chemical vapor for a period of time. External indicators are chemical dyes that change color upon a short exposure to sterilization conditions. If the indicator fails to notify the ICO, environmental repair, blah, 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 secure, all management goes far. Alright, only biological monitoring can tell the patient whether or not, it's missing more. Can only go so far. Alright, so biological monitors, it's recommended at least weekly, but preferably daily monitoring is done. So essentially just, making sure that these certain things aren't being contaminated. So if we're having a positive result, you got to notify, the person that's in charge and report test results. If you have a second positive biological test failure, notify Biomed, because they need to come fix the machine. We test sterilize it. Any questions? One more to go. Alright, patient manual, chapter 11, fundamentals of patient care. Alright, so to go over this real quickly, you guys should know this one. Right? It doesn't matter if you're done this or not. Right? Trident juncture, or not joint commission. So if anybody wants to know more about that, the joint commission, right? So they develop standards addressing the rights and responsibilities of the patients, but also they design kind of like your protocols that you do in the hospital to make sure you're taking the best care of your patient. The patient's bill of rights and responsibilities are found in the BUMED Instruction 6300.10 Series Chapter 3, Healthcare Administration. Those are also supposed to be posted up in every patient room, facility, everything like that. So that's where you get that information if you want it. HM Occupational Standards, NAPCR 18068 Series, Chapter 40 and 41, define minimal technical skills required for a hospital foreman. How much do you want to bet you don't have to visit the years? Aha, lied, I just looked at it. Senior Medical Department Representative is usually Senior Chief of the Hospital Corps, also IDC. Malpractice occurs when the individual, gets injured or something like that from negligence by a provider or one of the technicians. Legal limits of practice are defined in each state by certifications and qualifications. Patients are governed legally by the name and regulations and BUMED policies and only perform those assignments and duties while under the authority and direction of the U.S. government. So what does that mean? You go out into town, the civilian gets in a car wreck, you're not automatically a freaking lifesaver, right? You're not going to perform that BLS on them. You can, hopefully they'll get covered, right? But you can get in trouble for that stuff. Form pledge. Did you guys have to do this in Portsmouth?
Yeah.
That hasn't changed. Right. You guys all know what a freaking culture, race, religion is, right? Gender is, age is. So basically, this is just pointing out the things that you have to pay attention to when you're going with, like, dealing with the patient, right? What is their culture and how do you deal with that culture? What is so depending on like what country you're in, stuff like that, what race, and how do you deal with the kind of culture? It's kind of more based on culture on that point. Culture aspects to deal with that. Then gender, like say you were in Afghanistan or Iraq or some of the more traditional Islamic countries, they don't like to have men in the same room as women if you're not married to them. So you have to kind of realize that kind of cultural background and make sure you don't fuck that up because that can be serious implications for the patient. Not for most of them, but most of them. All right, communication process consists of 4 basic parts. The center of the message, the receiver of the message, and feedback. This one I've seen many times. So there's 4 processes. There are 4 basic parts of the communication process, right? So, and then it will just kind of break one of these down and tell you which, like ask you which part of that process is it. So 2 types of communication, there's verbal and nonverbal. The way you gesture yourself, the way you show, present yourself to others, if you use your hands, talk, stuff like that. Barriers of effective communication, physiological, physical, psychological, and psychosocial. Listening skills can be improved and enhanced by hearing and speaking out, focus on ideas, remove and manage distractions, maintain objectivity, and concentrate on immediate interaction. So, the contact points program. Patient contact program is an overarching program facilitating 2-way communication with patients, so both complaints and compliments are documented, tracked, impressions made, improved MTF and NCIDC experience. Therapeutic communication defines face-to-face process interacting and focuses on advancing physical and emotional well-being of the patient. Communication has 3 general purposes: collecting information, assessing, modifying behavior, providing health education. Patient education, the goals of the process include assisting the individuals so they may acquire more knowledge and skills and promote their ability to take care of themselves, influence their attitude or change their orientation, emphasizing disease, and basically trying to make them aware of what's going on so they can help themselves, support the behavioral changes to the extent individuals are willing to able to maintain health. So basically if someone doesn't know what the heck's going on, you give them information. They try to build up that knowledge base and then try to get them to take care of themselves. Alright, so who's done a subnote before? Alright, subnotes are very basic and it's kind of like our building block for taking care of patients because it relies on just 4 things and half of it's really the patient, half is you. So your subjective viewpoint of the patient, so what the patient's telling you, right? So you don't change anything, you get it word by word, you write it all down, and whatever they say is what they say, that's their subjective viewpoint, you don't change it, right? Objective is what basically you can see. So they're complaining about their knee and they tell you how the knee got broke and all this other stuff, and you go in there and you can do your certain tests to see if that knee's got freaking ligament tears or broken or whatever the case may be. That's your objective view, but you're not assessing that yet. Assessment is your preliminary findings of the actual patient, giving them a diagnosis or at least the way to identify what's wrong with them. Then you're planning how you're going to treat that diagnosis. So just basically just going over things to look for when you're assessing a patient. And depending on what you're assessing for, depends on what you're really going to be paying attention to. A lot of the body posturing and physical tells you kind of want to know. So is their gait uneven? Stuff like that. Any questions? Well, that was fast. I thought it was longer. Any questions on that? None? Whatsoever. Good, cool. Hey, you guys, that was the last one for me, I think. Basically, if you really, really want to pick up, you're going to be the person that goes home and says, I really, really want to pick up. And you're going to take all your distractions away, and you're going to find a way to actually study. And you're going to put yourself in a position where this is it, right? This is the last test you got. You have to make this test so you get kicked out of the Navy and all that other bullshit that's wrong with that. That was me when I was picking up second class. I literally had one exam left, and I went into the exam, I studied my ass off and did everything I needed to do, right? To a point, because I was still kind of lazy in that. And I picked up, moved on in the second class, and then I went first, right? I was 4 months away from being a gold first, or a gold second. So, I'll tell you how long I've been in. So I was about to be a gold second. I thought it was kind of funny, but at the same time, I didn't want to be that kind of person. I wanted to put on the gold chevrons and walk around as a second class. So, I really kind of put my mind to it. Said I have to study, I have to do this stuff. As boring as it is, day 4, I think I was dying in this classroom because people after person, PowerPoint after PowerPoint, test after test, everything was going on. But I kept pushing. I'd go outside and then I'd walk back inside and then get back to it, right? You gotta take little breaks, personal time for yourself to just kind of like de-stress, and then you get back into it. Because if you really, really want to pick up rank, that's the only way you're really gonna do it. Is by putting yourself in this kind of tough position to succeed with, right?
Chief, the Master Chief speak real quick?
Yeah.
Yeah, oh yeah, it's Master Chief Fletcher.
Yeah.
Oh yeah, he wants to speak with me or he wants to?
No, he wants to speak to the class.
Oh yeah, absolutely. Hey, how you guys doing? Was it afternoon? Yeah. How you guys doing? All right, hey, I'm Master Chief Fletcher. I'm from 2nd Marine Division. I'm just stopping by to say hi. How many of you have done this EAP before? Just a couple. That's it, so everybody else is first time? Okay, awesome. Hey, this is built by the sailors, for the sailors, right? So I'm always just trying to hop in, see how many new folks we're getting, and then just to ask you to provide them honest feedback, and then to keep pushing the word out, to get it out there. So we've got hospital. Who's hospital? Obviously everybody in blue, right? And, okay, good. And MLG? Okay, division? Oh, makes it hard. All right, hey, seriously, thank you guys for being here. I mean, this is for you, right? Make you guys better and give you a good shot at the test and all that good stuff. So, you guys finding it be beneficial and all that? All right, hey, like I said, I don't want to take up any more time. I just want to come in and say hi, say thanks, and ask you to please provide good feedback and then just keep pushing the message. The more we can get out, would you say 17,000 people now, I think?
Yeah, a little bit over now. It seems to definitely pick up now that we're kind of getting into February.
Right. This is only the second time this has been run, so pretty awesome. All right. Hey, well, good luck. All right? I'm not saying congratulations. Not yet, but hopefully since you're in here.
Yeah, why don't you guys take a 5-minute break?
We're a little bit behind. Alright, so listen up. Let's get rolling. Unless you guys want to be here till 16:43. We won't be here that late. We have to be out of here by 16:45.
15 minutes bar.
Gloria, I'm gonna use that all day.
Alright. So makes one glory again. I know you guys look behind. You guys are probably dead by PowerPoint at this point. I'm going to speed through this yet again over the stuff that's important. That way you guys don't have to stare every slide. Alright, so at 12, patient care. Kind of went over this stuff when I taught P117. So in patient care, this is all nice stuff. Wash your hands. Make sure specimen's on thing. Next. Alright. Yeah, basically the physician desk, that's basically activity. Next. Alright. Primary reasons for bed rest. Basically pneumonia, gastro, whatever. It's never on the exam. Next. Alright, surgery. This is actually fun. So the main thing you have to know are the pre-op, operative recovery, and post-op. They go into more detail. So your pre-op is basically procedure. You're going to get a procedure done. The main thing you have to do is this 522, SF522. That is your anesthesiology request. So that has to be filled out during the pre-op. You will not get surgery if that is not filled out. It has to be someone that's either 18 or above. That will be on your exam most likely. Alright. Your operative is basically two factors, your positioning and anesthesia. Basically the main thing is the anesthesia, is it local or is it general? So with the anesthesia, the regional is topical, local, or nerve. The most common ones we do is the regional. So if you're doing a block or something, IUD, someone gets bit by a spider or something, cut it open, drain it out. You want to make sure you want to lidocaine that area first, obviously. That's basically the blocking area, so you don't feel that pain when you're cutting through there. General is basically when you're actually cutting others. It's basically the main difference. Spinals, we'll never ever do a spinal. You basically have to hire top level surgeon for that. But you hire your third and fourth, your fifth, and your first. Alright. With these other spaces you may see. So if you're doing a spinal block and you're saying, okay, I want a saddle block, it's going to be through the third and the fourth lumbar space. I have seen that. Basically, it's like in one section of the lumbar, would you do a saddle block? Okay, like third, something like that. All right, general, I have seen these in the exam. So basically, you have to go through the 4 stages. You have your induction, you have excitement, then your surgical stage, and your toxic stage. So induction is basically you just gave it to them, it's not a little woozy. Excitement, okay, they may now start to be having a little bit of anxiety with the anesthesia that you gave them. Surgical stage is they're basically good to go, ready to sleep, and you do your operation on them. For toxic, they actually had a reaction to it. Basically the 4 different stages. The only one you really can do surgery on is the surgery stage. That's basically just what your vitals will look like. It's never on the exam. Next. This is all common sense stuff. Next. Alright, for orthopedics, so short cast, basically just going to be from the forearm to basically the knuckles of fingers. Long arm cast basically all the way up to the elbow, making sure you can keep a 90-degree angle. And then your long leg cast, basically, for leg cast, they can last up to 24 or 48 hours. So it may take a while for them to dry, considering how large material you have to use in the mouth. Alright, I've seen this on the exam multiple times as well. So the most common assistive device is going to be a seat hang. You would need to use 15 to 25% of the patient's body weight. That's basically what the cane is for. So I know I've seen that question too. Is basically how much body pressure would you use for a cane? 15 to 25%. Crutches, basically, they only use auxiliary crutches. Everyone ever uses full arm, right? Things they should just auxiliary crutches. It's not working. Crutches. I've never seen walkers on the exam. Basically, there's different types. You either have your standard walker, it's just click, click. Your wheelies are the ones that has like tennis balls on them. See, grandma and grandpa walk around with. The floor walker, basically that's one that has like swivels on there. I have no idea what the one hand. And the stair climbers basically just get up and up the stairs. Terminal, respected height. Alright, stages of death. So I have seen this in the exam as well. So what are the 5 stages of death? Well, most likely, if the patient is knowing they're going to die, what are the stages? It'll be denial, anger, bargaining, depression, and acceptance. Know this in order, because this is the order that it usually falls under. So denial, like, no, I can't. You gotta be wrong, doc. Like, I'm not dying. You have to have results wrong or something. Anger is basically why me. Why this happened to me? Like, I'm not supposed to be dying. Bargaining is like, come on, doc, I'll give you extra, like 10 grand. Like, make sure you do what you gotta do to make me alive. Depression, basically, you're basically starting to feel sorry for yourself, knowing that you're actually going to die, and accepting it. Like, all right, I'm accepting it, I'm ready to go. That's the 5 stages. Patient safety. These are like the 4 major types of accidents: so falls, electrical shocks, physical, chemical burns, and fire explosions. Basically, the one we see the most are basically falls or physical. Can't really go into too much detail. Nothing here is really that important. This is all common sense. You see electrical safety, you're not going to use electrical equipment around the electrical. You're not going to put water around the electrical stuff. If something's broken, you're going to go to biomed. You're not going to fix it yourself. They're the ones that the experts are supposed to be able to fix it. Ice bags can cause local frostbite, so if you keep on there too long, they can get frostbite. For the burns, make sure if they're doing like water treatment, doesn't go higher than 125 degrees. That's when it actually stops burning, so you're getting higher than hot temperatures. Alright, so for the regulations, make sure you know this instruction is 6212 as to tobacco use. So basically, no one's allowed to have tobacco within the hospital facility. Then that falls under that instruction out there. Hygiene, be clean. Go. Pushing through, like I said, I'm not going to go with this stuff. I know it's important. A lot of that stuff is just not, or it's common sense. I think you guys know how to wash your hands. I do not know how to use So this one, so what, 12, 13, and 14? Which one comes out of that? Is H&2 still coming back for the last one?
H&2 rack I was teaching the last.
Tuttle is...
Yeah, Molly?
Yeah.
They swapped this morning. Yeah, she'll teach the last few, the last 7. Yeah, I know this stuff is brutal, but a majority of your questions will come from this, alright? Doesn't mean dedicate your time just reading the format manual though. But, you know, understand this information and try to highlight this stuff in either black or red. That is kind of key. Remember. Right, super good.
Alright, eat healthy. Energy comes from age and gender. It's never on the exam. Next.
Well, I'm not considering.
All right. BMI, basically body mass index. Anyone know how that falls under? But they get all that the physical assessment with the ATMAP 6110. That one. That is an instruction you need to know for your exam. So basically that's the PRT instruction. 5 food groups: grains, vegetables, fruits, and your one here. Next. Alright, human body consists of 60% of water, and you basically lose about 5 to 7 each from eating foods. Carbohydrates, no, they'll provide 4 calories per gram. That's basically all you're going to do, your starches and everything. Alright. Proteins are also, know that as well, it's 4 calories per gram. And these basically building blocks, so basically build on muscle and everything. Alright, your fats, they consist of 9 calories per gram. I mentioned those because I have seen those in them. Like how many calories will protein be? Like 4, 6, 5, you get to choose from.
Also, the question is which source of energy is the most nutritious? The answer is fat.
So that's on right here. Fat supplies the most energy. Basically, that's what the fat is for. Not only provide cushion, but it actually supposed to provide the most energy because it takes longer to break down. Carbohydrates take longer, so if you eat a lot of people with carbs or anything like that, like after you eat, like an hour later, like I'm hungry again, and you broke it down already. But if you like proteins or anything, you're pretty full for a while. So it's like things like that.
Also, I've seen what kind of fat soluble or whatever.
Yeah, I was going to go that right next. So, know your fat soluble, ADEC. If you haven't heard that acronym before. And there's more after that for water soluble. Coming up shortly. Trans fat's bad. I really haven't seen anything else on here that's really currency for the exam. Except maybe biosocial goods or whatever, created in the body. Alright, so we already mentioned the fat soluble, the ADEC. Now there's also the water soluble. So you have your vitamin C's, thiamine, riboflavin, lysine, B6, B12, folic acid. Does anyone know what another name for thiamine is? What do you want? What about riboflavin? That is a test question. They are guaranteed to be on your exam. One of the B vitamins will be guaranteed to go in there. They say, okay, what is riboflavin? Another name for it. B2. It's on every single exam. Other than that, that's basically the main ones. Alright, so your diet therapy. So we're going to get the diet therapy soon. Alright, so for clear liquids, basically you're sick or anything like that, it's basically what they first suggest for you to utilize once you're sick or if you had a surgery. You're not used to solid foods or anything like that, so keep it easy in your body. That's what basically the clear. Full diet, or full liquid diet is basically like your milkshakes and everything. Your Ensure, just so they can get a little bit more substance in their body. The body really can't take too much solid food yet, but this is the starting point for them to actually start getting more calories in their system. Never seen dental liquid. It's based, I mean, I have seen it. I had a friend had the surgery. Basically, her mouth was wired shut, and she was doing Ensure for 2 months straight. She hated that. Soft and bland diet. Basically, if someone's sick again, having boo-boo tummies, you're going to do a bland diet. Pureed diet is basically almost the same thing as a liquid diet. Your food's pureed. It's basically like baby food almost. You're just drinking protein shake. Alright, high calorie. So basically, this is going to be for people that had to go like a major trauma, like a burn or something. Calorie restricted diet, basically someone's lost or needs to lose weight, so if they're diabetic or something like that, sometimes they may have them calorie restricted. Don't get it confused because they'll have them for cholesterol, or not cholesterol, but light on carbohydrates as well. Protein restricted, basically those that have renal disease, their renal system cannot handle too much protein, so they're going to say, okay, limit the protein, you still need it in your system, but don't take as much. So reduced fiber. So some diets require you not to, they want you to gain more stool, because you're basically running, so less in the fiber, that way they can actually collect it more. Compared to high fiber, it's like you need to get that stuff out of your system. Alright, so this is what I was talking about, the carbohydrates. So for those that are diabetic, they're going to say be aware of that because the sugar's going to mess with their sugar levels. Low sodium, basically, common sense, basically those have cardiac issues, you don't have low sodium because you don't have that high blood pressure. And then gluten-free is basically those for celiac disease. You know how to get supplements in your system. Alright, and that is that. Fast enough? Alright, we got one more, and that's even faster than that. Only like 10 or 15 slides. Not gonna do like that. So I'm powering through this, like I said, I'm only going to go to stuff I know that's important that I've seen in the exam. I know you guys are good. There's some instructors that will try to. Do you guys have any questions or anything on this stuff I've gone over? It's pretty straightforward.
Pretty straightforward.
And from this diet one, make sure you understand if somebody has this, what kind of diet you use. Okay? Those are pretty common questions. So like if somebody has diverticulitis, what kind of diet will you use? High fiber. Understand?
High fiber, low fiber, depending on the situation.
Well, yeah, but understand which diets coincide with treatments. And then I think there's that vitamin test on your guys' daily test. That's good to understand that stuff too. And then there's some stuff has anybody looked at Master Chief Ranker's study guide? I know that stuff's kind of outdated, but some of those ditties are still good to understand. And then there's some good little things on there you can use in your day-to-day job.
Alright, physical exams, PHAs. We're doing basically this all over again. Who's authorized to do it? IDCs, the medical providers. You guys aren't authorized to do it, you guys are going to be like vitals and stuff. What's required for physical exam? HIV, cholesterol, audiology, every stuff you do every single day. Again, stuff we're going to be filling out is the DD 2808 or 2807. Which one's the two difference? Which one's the 2807?
History.
History. What about the 2808? How often you have to do it? The instruction you need to know is second half 6112 or 20, not 3. That is probably going to be your exam. I think that was online. Alright, so your separation exam. DD form 2697. So I'm not going to beat around the bush. I already talked about this when I did the P117. Was the same stuff over again. So if it's on there twice, usually meaning they're probably going to be in the exam. You have more chances for being on the exam. Talked about that already. Alright, so for the suitability for overscreening, make sure you know UMed instructions 1300.2. That's going to be for both you and your family member. conservation programs, is basically, or the occupational noise, basically, that is, that people coming in or messed up hearing, that's basically them just doing their safety keeping. So do it for aviation, or anyone that does anything with loud noises around them. For those at FMF, you guys already know what's the sound decibel levels or anything, your FMF thing. It's basically the same thing that requires for this. For those that are not FMF warriors, for those that are FMF warriors, the guys in blue, what are the decimal levels for each one? So for single hearing, what is it? What is it? So 104. What's double? 14. That's for single. What's double? 84 to 104. There we go. All right, so for the MEBs, for the evaluation boards, like I said, we went over this before. Light duty, want to do it for 30 days. Once it goes past 90, then we go on limb due. 2 limb due periods, have to get approval from provider before you go on a third due, and then you go on the med board. Unless they deem necessary, you have to go on the med board right away. You're just not going to get fixed. You're just beating around the bush for limb due. Like I said, this one's real fast. The main subcomponent, P117. I would not focus too much on this particular chapter. P117 is the main focal point. You guys think about this one. This little things I said there, it's just redundant from before. So this chapter is not that important to you. Any questions or anything? Alright. Good luck with everything, guys. May teach again if you guys don't have an instructor, so I'll teach you guys again. Alright. Let's have a good one. Like I said, good luck. Hey, take a quick 5. What's up, man? Take a quick 5.
Which I
Everybody back here? Where are we missing from this classroom? Nobody reported. Alright, sweet. So I'll tell you guys, like I told the other class, so I went through all the PowerPoints. They're great. They're freaking a lot of information in there. But I'm not going to insult your intelligence and pretend like you guys can't read. So I'm not going to read it to you or anything like that. What I did was I went through the PowerPoints, went through all the chapter, and I made a bunch of notes on stuff that I saw, the fine print on, who governs this or who's responsible for cleaning the freaking spit container on the dental tech freaking van or whatever. So I'm just going to go over the freaking waypoints. Okay, I'm going to go over all the waypoints, all my notes. Like I said, you guys have PowerPoints. The PowerPoints have a lot of the finer details. For example, chapter 15 is dental exams. There are so many dental exams, I don't have enough time to go over all of them with you. Okay, and I'm supposed to cover chapter 15, 16, and 17. All right, so again, we're going to go over it really quick, then I'm going to go over to the next classroom because I know it's hard to hear, and I'm going to do the same thing with them. Okay, so if you guys need to take notes, let me know to slow down. Most of this stuff is stuff that's in the PowerPoints though. Okay, so chapter 15. First of all, my bad. So my name is H1 Calzada. I run Division Combat Skills Center. We teach all the freaking training for division. Okay, so chapter 15. So that is dental exams, okay? So I think you guys covered chapter 15 of the MATMED already, correct? So that is where all the standards are. So that also covers some of the standards that are in this chapter, okay? So for more information, if you guys struggle with some of the exams or standards of exams for this chapter, you're going to reference chapter 15 of the MATMED. So your dental record. Somebody tell me the nomenclature for that? Right, so that is the NAVMED 6150/21-30. Okay, so I've seen that on all of my exams in some way, shape, or form. Either they reference one of the covers, what's on the back, what's on the front cover, something like that. The dental health questionnaire. Okay, how often do you do a dental health questionnaire? Annually. It's actually every visit. Right, so if you go in, even if you already did one, they're going to make you do another dental health questionnaire. Right, because obviously you're in there for a reason. So there's a lot of different types of exams. We're going to start off with the accession. Right, so the session, what does that mean? When you join, right? So that's done. So you do an exam, a full exam, and an X-ray. So that's only when you join. Then you're going to do periodic. How often do you do periodic? You think? Annually. That's correct. There is 4 types of periodic exams. Right, that's important. So type 1 is comprehensive. So that's an extensive exam. They're going to do everything. Little freaking mirror, X-ray, the whole 9. Type 2 is oral, which is just a routine. That's what most people get done. Type 3 is a diagnostic type. Right, so they need to figure something out, whether you're going to do a root canal, something like that. And then type 4 is a screening. Does anybody know who can do a dental type 4 exam? It's just a screening. Think about it. Anybody. So a dental hygienist can do it, a freaking corpsman can do it, a dental tech. So anybody can do a screening. Those are your 4 types of periodic exams. Then you have a suitability or overseas screening. When do you do that? Going overseas, operational duty. Sweet. So this is the big one. So this is governed by an instruction. You know how the freaking Navy advancement likes to do it. Who governs this particular advancement or this particular section? So it is governed by NAVMed Com Instruction 1300.1, which is the overseas screening instruction. Makes sense, right? Sweet. And obviously there's a form associated with it. So if the instruction is 1300.1, what do you think the form is? 1300/1, absolutely. So that is the overseas screening form, okay? Sweet. The last type of exam is the separation, retirement, or special programs, okay? Now, the guidance for this, where do you think you're going to find it?
1300.1.
No. So special programs, separations. So your NAVMed chapter 15, which is physical standards. Cool? Time together. Sweet. Somebody tell me what the classes of dental is. Class 1, 2, 3, and 4. Sweet. So now, what does that actually mean? So if you're a class 1, what does that mean? You're deployable, but what does that mean? For how long? So it's 12 months. So I know we all, it was actually a surprise to me. So it's the same thing, right? So it means that you're good to go for 12 months. So everything's based off a 12-month period. So class 1, you're good to go for 12 months. Class 2 means that you have something wrong that may get worse within 12 months. The class 3 means you have something wrong that will get worse within 12 months. And then your class 4 is you're just unknown or you require an exam. Okay? So just remember those 12-month period. Good to go for 12 months, may get worse within 12 months, or will get worse within 12 months. Sweet. So now, forms, right? Navy's freaking huge on forms. So the Easy 603 Alpha is your dental form. All right? So that is where they document all the stuff on there. The other thing that I've seen on my exams that always screws me up, and I have to go back and look, is what do the abbreviations mean on the forms? So if I tell you that 8-TAC MID needs work, what does that mean to you? Nothing right now, right? So it means that tooth number 8, the mesial, incisal, and distal side of the tooth need work, okay? So in your chapter 15, it is page, so I wrote it down for you guys. It's 15 TAC 15, I believe it is. So it has all the all the dental abbreviations. And I would strongly look through that because it has all the letters and what they stand for, which side of the teeth, okay? Again, I'm not going to go through that with you. How often are forensic exams done? So these are done once, right when you come in, right? This is pre-printed on the back of the dental jacket, okay? Pre-printed on the back of the dental jacket. You only do it when you come in, and then it's there forever, all right? So that is your initial exam, if you will. Just like medical, every time you come in, the dentist and the corpsman are going to do a soap note on it, okay? Does everybody know where the soap note is? Cool. What is the S? O, A, and the P. Sweet. So that's also going to go on the medical form, which is what? Easy. Sweet. All right, cool. So a DD 2808. So this was covered in your chapter 15 as well. What is that document? Medical examination, right? So there's only 3 questions that require dental. All right, so it is question 43, 44, and 83. Those are the only 3 questions in that whole paper that relate to dental. All right, 44 and 43 are defects and diseases, and 83 is the signature of the dentist. All right, so your 88 covers medical examination, and it covers dental as well. SF 513. Does anybody know what this form is for? You said what? Nope. It is the medical consultation, right? And it also covers your dental. So if you know that you can refer them with a 513, you can also refer them for dental with a 513. Okay? Sweet. Cool. That is chapter 15. Any specific questions on that? All right, cool. Chapter 60. This is operative dentistry, which sucks. So there's a bunch of dental specialists, right? So that is literally your first 2 pages of this chapter. Covers all the dental specialists. Yeah, I'm not going to go through them all with you. The biggest thing that has always made me angry about the advancement exam is when they ask me about four-handed dentistry. All right, where do you sit in relation to a right-handed dentist when he's sitting on the left side of the patient? It's in there, okay? So I need you to review page 16, tab 17 in chapter 16, and it is about 14 paragraphs on if you're the corpsman, if you have a left-handed dentist and he's sitting on the right side of the patient, where are you going to sit? It's been on my exam every single time, okay? Again, I'm not going to there's different zones, it's all in the same chapter. Just make sure you guys review that because I know for a fact they ask. What do you think the most common local anesthesia is in dentistry? Lidocaine, 2% lidocaine, okay? Most common local anesthetic. They come in 1.8 cc glass cartridges. All right, that's also been asked to me. What's the dosage on freaking 2% local lidocaine for dentistry? There's a couple of big programs that dental governs. So one of them is the Mercury Control Program for dental treatment facilities. All right. So this one is huge because obviously a lot of the stuff that goes in your mouth is going to have mercury in it. So there's a whole regulatory system to keep track of this, okay? That is an instruction. So it's BUMED 6260.3, and that covers handling and control of mercury. Same thing. They've asked me that before. What is the mercury control number? Sweet. Chapter 16. Everybody good? All right. Chapter 17. So this one is X-ray. All right, do I have any X-ray techs in here? Cool. All right, so again, this section is super in-depth. All right, covers what type of wavelengths goes in where. I'm not going to go over that stuff with you. Some of the stuff that is always on our exams is radiation safety. All right, so that's a huge section of this. So who governs radiation safety? The Nuclear Regulatory Commission, NRC. It's subdivided into occupational. What do you think occupational safety covers? Which group of people? What's that? Nukes. So the workers, right? So the workers. Then there's medical safety, which who do you think that covers? The patients. And then there's public safety. Who do you think public safety covers? Everybody else, right? So those are the 3 subdivisions that again, radiation safety covers. They factor your risk, how friggin' much elevated risk you have, by 3 factors: time, distance, and shielding. That's it. There is an acronym that you should look up. It's ALARA, which means as low as possibly or as responsibly achievable. Okay, that is what they base their regulations on. There is 4 types of procedures to reduce radiation exposure. All right, shielding. What do you think that means? Lead, exactly. Time. Reduce time. Distance. So this one is the only one that has an actual numerical value. So you have to be at least 6 feet away from the equipment that emits radiation. All right, 6 feet away is your cutoff mark. And then the amount of time, obviously, or I'm sorry, the amount of radiation, that's self-explanatory. The biggest thing is that all medical and dental facilities must follow local SOPs. All right, so that is who governs radiation safety in medical and dental facilities. Everybody's required to wear a radiation dosimetry badge. So how often are these collected? 6 to 7 weeks. What is the reading that you want to get on that? A 0, that's right. So 0 REMs, which means radiological equivalent mammal. All right, so that is the expectation. Anything above a 0.010, you have to be referred to radiation medicine. Okay? So here's some pages that I want you guys to focus on. So radiation levels and what they mean. So that is on page 17, tab 5. That is instruction. It covers an extensive amount of radiation levels and what they can possibly do. Also, on page 17, tab 5, it is the Title 10, Part 10 of the federal regulations, that is who governs federally radiation safety. Okay? Do you know what the manual for, the Navy manual, DoD manual for radiation health protection is? PTAC 5055, 5055. Right, so that is our DoD manual for radiation health. The other program that radiation covers is precious metal recovery program. Right, I've seen this again on all my instructions. So this is a UMed instruction, 4010.3, same thing, 17.5 on the page. And it tells you that lead and silver are saved and turned into supply daily. Right, so those are the only two precious metals that the Navy is concerned about. On page 17, tab 6 is the infectious control chapter. Same thing, huge. How often you have to do maintenance, what type of maintenance you do, and what level maintenance. And the last thing on this chapter is the maintenance schedule, which is on page 17, tab 39. So you have monthly and weekly maintenance. That is it. Monthly is you empty out the tank solution and clean it up. Weekly is you agitate it for 5 to 10 minutes. All right. Again, that has always been on my exam as well. 5 to 10 minutes agitation weekly of the solution. Cool. And that is all I have for you guys. You guys have any questions for me? Sweet. So like I said, after reading your guys' PowerPoint, it was pretty in-depth. All right, so hit these freaking wave points, and most of these questions that I asked you were also on your guys' quiz. Okay, cool. If you got nothing else for me, I'm going to go next door, and I'll see you guys. Good luck.
He was going to go talk to the other class real quick, just to make sure they heard him.
So that was 1560 answer? Correct.
Johnson, are you going to pull the other ones?
Yeah, I can do it.
Yeah, just right click and take a shot.
You know what? Okay. Fuck, it's doing it like a completely different way. What the heck? Didn't even think of that.
So now we'll have everything.
All you gotta do is right click exit show. I'll show you. You gotta go right there. Alright, listen up, station 2.
Alright, good afternoon. My name is HMT Rika, so got some good news for you guys.
Uh-oh.
I'm your last instructor today. Got some bad news for you guys. We're obviously running behind today, okay? So, I have the last 7 chapters of the Ford manual, okay? Woo! Right? Okay. You guys are third classes, okay? So you guys are not completely brand new to the Ford manual. You should have read it at this point to have advanced, okay? So we're gonna be kind of more so going back over, not teaching, like thoroughly teaching, but giving you that pertinent information, okay? Some of these slideshows are a little bit more in depth than others. I'm sure you guys have seen that already with going through the material, so we're going to go ahead and get started though, okay? So, chapter 18, pharmacy, okay? Anybody ever teach you guys the way of remembering the chapters? Alright, how old do you have to be to go buy cigarettes? 18, alright, so that's 21 for the other manual, correct? For alcohol, that could be considered a type of self-medicating, but for this one, 18, right? You gotta be 18 to purchase cigarettes. Okay, probably gonna have to do that for certain types of medications and things like that too as you get older, okay? Alright, first term, pharmacology, okay? For these terms. I'm going through a lot of these, right? Dosages. You want the pharmacotherapeutics, okay? So big thing is the study and uses of these medications. Know the differences between what they're meaning. Toxicology. This one I have seen on the exam. Alright? So study of poisons, their actions, therapeutics, signs of treating the disease. Alright. Remington, science and practice of pharmacy. So, work is known as the Blue Bible of Pharmacology. I've seen this on the exam as well. It might be like, hey, what's considered Blue Bible? Remington. Alright, so maximum dose and minimum dose. Least amount of medication required to produce therapeutic effect. Maximum dose without reaching toxic effect. Those are key terms. Toxic dose. Kill somebody. I want to get to that point. Okay. So therapeutic dose is referred as normal adult dose. Okay. So unless it specifies, and it will specify if it is a child, assume it's an adult. Okay. Minimum dose. Minimum lethal dose. All right. Can produce what? What term should give that away? Okay. Alright, so factors affecting dosages. Got age is the first one. So that first Young's rule, okay? And kind of cut off right there, but age in years divided by age in years plus 12 times the adult dose. You don't have that memorized, get that one memorized. They always have at least one of these questions on your exam. So just know that little thing right there when you're going through. And then it's easy to remember that this one's associated with age because of what name? Okay. Adult dose of aspirin is 650 milligrams. What is the dose for a 3-year-old child? So what was that fraction again? What was that?
3.
I need to go back so you guys can write it down. Okay. The age in years. Okay, so the child was how old? 3. All right. So that. What you guys get? That what everybody got? Okay. 3 over 3 plus 12. And you're gonna times it. Alright, weight. Clark's rule. Way I always remember this was a Clark bar. You eat too many candy bars, you're gonna get fat. Weight. Okay? So weight in pounds over 150 times the adult dose is gonna equal the child's dose. Okay? So give you guys a couple minutes to write that one down. So coming back to this, all right, the adult dose is 650 milligrams. Want the dose for a child weighing 60 pounds. Give you guys a couple minutes to get your answers. Everybody wrote down that problem, right? Same thing, just different rule. Okay, moving on. So other factors, okay? So you got gender is gonna impact it. Sometimes race is going to as well. Different things that they are associated with while they're working. What are their daily tasks and things that they're doing? So are they smokers? Are they heavy drinkers? That's why we ask those kinds of questions when we're looking at medication dosages and things. What's a question you're going to ask females specifically? Pregnant, okay. Or?
Breastfeeding.
There you go. What's another thing you want to really specify with medications? Maybe the route? How to take it? Alright. So, methods of medication administration, okay? So, the first one is oral. Probably the most common. Alright? We have some sublingual and buccal. Under the tongue, cheek and gum. parental medications, or paraneedles, excuse me. All right, introduced by injection. So you have subcutaneous and intradermal. So with sub-Q, what kind of injections do you want to do sub-Q?
PPD.
Okay. That's not,
Insulin.
okay, sub-Q, that's a different one. But insulin, why? What's the difference? Okay, so sub-Q, you want a slower release of the medication, okay? An IM, you want a quicker release, going right into those muscle tissues. Okay, sub-Q, it's going through the fat layers, so it's gonna kind of seep in, alright? Sub-Q more so when you're looking at insulin, allergy, shots, things like that, whereas IM, you're what? Antibiotics, pain meds, you want that quick, okay? Alright, intradermal is for what? You said it earlier.
PPD.
Okay, there you go. So, alright, then we already went through IM, and then you have IV as well, introduced directly through the vein. And then have intraspinal on the bottom, introduced through that space, the spinal column, okay? Alright, you also have inhalation. So, ways of getting through the respiratory system. They can do vapors, they have gas inhalation, nebulizers, and fine sprays. Topical, applied to the surface of the body, okay? So for localized effect or a systemic effect. So either absorbed through the skin to the bloodstream or just to that one area, okay? Then you have rectal and vaginal, self-explanatory. Okay, your 6 rights. Everybody should know there's 6 rights. You should be saying the 6 rights before you administer any sort of medication. We're probably going to have a question on this as well. Okay, right dose, right patient, right medication, time, documentation, and route. Alright. Chemical name, generic name, brand name, okay? So relates to the chemical structure. Your generic name is the name of the medication, your brand is the people selling it, okay? So chemical name is gonna be something usually super long, scientific, probably something Latin based in there. Alright? Generic name is gonna be the name that is more identified by, say, like the hospital or whatever. So, for example, when we look at someone, we give them ibuprofen, we're going to say ibuprofen. You might say that to your patient, and they're going to be like, well, I don't have any ibuprofen at home, but I have Motrin. And then you're going to kind of turn your head for a minute, look at them, and be like, yeah, just take that, okay? That's the difference, right? Same exact medication, one is sold by the company, one is just the manufacturer's name for it, okay? Alright, so there's that long example. Alright, other medication classes. So we got astringents, medications that cause shrinkage of the skin. You have emollients. You think of emollients, just think of like cream, or not cream, but more of like think of like Vaseline, things like that, okay? Kind of like that thick. Expectorants, they're gonna make you cough up whatever is stuck in there. So next DM is a good example of that. Alright, antitussives, suppress coughing. You got nasal decongestants, stop your nose from running. Antihistamines, or antihistamines. What Who do we give those to? Allergies, right? Because histamines are attacking, so anti. Alright, so antacids, give someone who's having gastric issues. We got antagonists, block histamine, that's just been continued on. So Prilosec. We have antiseptic, disinfectants, and germicides, primarily intended for the prevention of infections by destroying bacteria, preventing their growth. Definitely know the difference between antiseptic, germicide, and disinfectant. I've definitely seen that on the exam as well. The one is going to suppress, it's not going to completely wipe it out. One's going to kill, and one's going to disinfect the area. All right, getting more into antibiotics now, okay? So, sulfameds, first effective. I've seen this question, I've seen it stump a lot of people because they always get it confused with penicillin, all right? Sulfas are the first effective antibiotic that was used, all right? Both gram-positive and gram-negative organisms, so Bactrim, Septra. Know the names Bactrim and Septra when it asks, all right, what's a sulfonamide? Penicillins, derived from a number of penicillin molds commonly found on breads and fruits. Who's seen that one? What kind? I was going to say, I've seen that one before too. Alright, cephalosporins. Because they're similar to penicillins, some patients might also be allergic to them. So that's something that we ask our patients when we're screening them about medications. Do you have any allergies to medications? This is why. They react to one, they might react to another, especially if it's in the same family. So you have, for example, go back to penicillin, you have penicillin, and then you have amoxicillin. Same family, different type of medication. Still can affect the person the same way. Alright, tetracyclines. Most important mechanism of action of tetracyclines is the blocking of the formation of polypeptides. Know that. Usually, a tetracycline is going to be your go-to for treating almost everything. I don't know how many things there are in the chemoprophylaxis manual, and it's like, oh, treat with doxy. It's one of the number one side effects of doxy that you might want to warn your patient about. Dreams. Alright. Aminoglycides, method of action by inhibiting protein synthesis. And then macrolides, effective against gram-positive. Okay, so you see vancomycin, erythromycin, zithromycin. It's not going to say the zithromycin. They're going to say, hey, what would you treat for gram-positive cocci? And then it's going to give you just macrolides. And you're going to need to know that's what that medication in your family is. Alright, antifungals, suppress the growth of systems of fungi. Antiparasites, what do you think those do? Okay, so, antimalarial medications that are used to treat or prevent malaria. Alright, laxatives, passage and elimination of feces. Diuretics, agents that increase the rate of urine formation. Okay. Non-narcotic anesthesics, also known as relieve pain without producing unconsciousness. Alright. Antipyretics, fevers. Tylenol is not an NSAID, it's an antipyretic. I've seen a lot of people miss that before. Anti-inflammatory, suppress inflammation, ibuprofen, Lorcin. Alright, CNS stimulants, medications that stimulate the activity of various portions of the central nervous system. And then CNS depressants range in action from mild to deep coma. So, stimulants, just think it's going to wake you up. It's going to make your brain do a lot more because your brain's under-reactive. Whereas those ones are going to calm you down. Okay, opium. Activity of opium is primarily due to morphine. Who are you not going to give opiates to? What kind of patients?
Children.
Okay, children's one, but specifically, you have someone come in with a car accident and their head's bleeding. Head injuries. Okay. Skeletal muscle relaxants, alright, used to relax the muscle spasms. So Flexerol, Boxin. Alright, cardiovascular agents. Amyl nitrate. Anticoagulants, heparin. Should be beat over the head by that one by now. Epinephrine, okay? So, vasoconstrictors. What's happening when somebody's having an anaphylactic reaction? Are their veins constricted or are they dilated? They're dilated. That's why they're swelling. That's why their body's freaking out. So you want to constrict everything. Alright. Your vitamins. A-Deck. Classified as general, local. Someone tell me what's the difference between general or local, without looking.
Local is like your big toe. General is like your whole body.
Perfect. Alright. Ptosis, so contraction of the uterus, Pitocin, things like that, it's going to make help a woman go into labor. Aromatic sweetened, so solutions contain medicinal substances. Okay, so those are going to, elixirs help, like, we usually do those for what kind of patients? Children, because they don't like medicine, so we put sugar in it. Right, suspensions, of course, insoluble material suspended in a liquid medium. Ointments, not to be confused with what? Emollients. Similar, fatty oils, but just know the difference between the two. Just trust me, that'll be a question on there, and they'll have both on there, and you'll be like, oh crap, I just remembered fatty. Suppositories. Capsules, we got gelatin, solid or liquid. Parts of prescription. Alright, so know this form, mostly for this. Because it's going to be like, hey, what's the form for writing prescriptions? So it's that DD form, 1289. And then know the difference between like what the signature is going to say. So, example, it says it's the directions for the patient, okay, not the signature of the person who's prescribing it. Example. Okay, know these classes or these schedules because that is definitely something they can definitely ask you guys about. High abuse, not acceptable, or moderate dependency. Class 4, less abuse, so, or class 5, limited abuse potential. See the examples that are attached with these two? I'll go back for a minute. Know what these examples are in terms of like the schedules of these medications. Why do you think LSD is up there? Because at one point they did prescribe it to people. They were testing it. Questions? I'm sure there's plenty, because I definitely just shot through 44 slides in about 15, maybe 10 minutes. Yes.
Something I've seen on the exam a couple times is like they'll ask you, can you write like a narcotic on a multi-script?
Mm-hmm.
You know?
Say that one more
They'll
time.
ask you like, can you write a class 2 or class 3, or can you write like a class 3 on a multi-script for a high abuse of schedule 2? On a multi-script, and it's no, you can't write it with other drugs.
So what could you do in place of
You
that?
have to write the DD 1289 for the schedule 2, and then you can write all your other drugs on the multi-script.
Does everybody understand why? Because those other drugs for this one specifically, usually if you're getting a medication like this, your patient, it's being tracked, okay? So they're going to be tracking it and making sure that that patient who has it isn't going to start distributing it or running through it. And this is kind of like their safety net, making sure that the patient isn't abusing the medication or also distributing it. And those other medications can't do that one, okay? Same thing, if you have multiple, you're also going to do separate what he's talking about. So that's a good point. Thank you for bringing that up.
So consider this like a second up here. So scroll over all the way to the right, and right click on it and shift to the top corner.
Alright, moving into lab number 19. What's your DD form for lab forms?
550.
Anybody have you used one of these yet? When your systems all go down at the hospital? In the hospital cabs? No?
Yep.
They suck. 545. That's what it looks like. So no, SF 545. Lab is your lab. Alright, so you got your blood collection methods, okay? How many degrees is that angle going to be in?
15.
With that, the needle prick on the finger, what are you going to do with that first droplet of blood? Why?
Because it has contamination, dilution.
Alright, so we're going to go into these procedures, okay? You guys kind of saw the pictures right there. Who's never drawn blood before? Really? Y'all never drawn blood before? I was going to say, what? What are they doing in court school now? Alright, so venipuncture method, okay? Collection of blood from the veins. Venipuncture. Not to be confused with intravenous. Alright, fly tourniquet through the arm. How many inches? 15 degrees, we already went through that. Specimens are to be labeled immediately after blood collection and never before. What's going to be on that label?
Patient information.
Okay. What else should be on that label? Okay, what else?
Time.
And?
Day.
There you go. Alright, venipuncture. Kind of went over this. You're going to use usually the middle finger. You're going to massage it up. 5 to 6, you're going to repeat milking the blood 5 to 6 times, okay? You're going to cleanse the fingertip. You're going to wipe away the first drop of blood to avoid dilution of the blood tissues, okay? dealing with infants and very small children. What's a good other place to go instead of their little itty bitty fingers?
The heel.
So just some examples of what can go wrong if you shoot when you're doing a venipuncture. What how's that bevel gonna look when you put that needle in? Okay. So microscope. I don't know how many times I've taken the exam. There's always a microscope question on there. And there's always a little diagram, and it's like, hey, what part of the microscope is this?
Stupid too.
If you have not looked at the microscope and memorized those pieces, you need to do so. Some of y'all who missed the exam by like 10 questions, 10 points, 10 questions. Some of them are easy questions, like this. This is an easy question. You just have to know what it is. Alright, so parts, framework consists of 4 parts mainly. You've got your arm, your stage, mechanical stage, and your base. Alright, illumination and magnification. Okay. Big takeaways from this is the low power, high power, and oil immersion. Right? Know the difference between what is low power, what is high power, what is oil immersion. Alright, CBCs, complete blood count. Right? So they're getting you your red blood cells, your hemoglobin, your hematocrit, white blood cells, and then other different counts that they might be looking at, right? Blood cell counts. So, consists of those five tests. What's your blood sheet look like? What color, typically?
Lavender.
Lavender. Now, who's pulled a CBC out of a different blood tube before? Color-wise.
Wasn't it also marble?
Marble tops are good for that too.
Yep.
Alright, so is your hematocrit. This is how they're pretty much a big machine. They spin it up, and then they look at the blood once it separates. Alright, so thick glass slab, 3 raised parallel platforms, 35 counts of red blood cells and white blood cells. So the procedure, you're going to discard those 3 drops. Gently squeeze the reservoir while touching the tip of the pipette next to it. I'm not going to lie, I don't think I've ever seen this on the exam. Has anybody else? Okay, we're going to go back down to right there. You see that part that says normal red blood cells? Know the female one, specifically. I've seen that one numerous times. Definitely know the male and the newborn one as well, though. Okay. So what happens if they don't have enough red blood cells? What's that indicative of? Counting chamber. Alright, so women, 12 to 16%, men, 14 to 18%, infants, 17 to 23%. Alright, this is for their hemoglobin. The hematocrit, a little bit different. By a little bit, I mean it's almost tripled in some of those numbers. Now the difference between hematocrit and hemoglobin. Microhematocrit method is the most accurate manual method of determining blood volume. I would know that. Alright, total white cell counts. So all of those. then we're gonna get into some different, indications for, why it might be elevated. Okay, so you have leukotosis, which is an increased values of white cell count. You got pneumonia, meningitis, and it's usually indicative of an infection of some sort, or swelling of that area. Whereas on the opposite, you have condition of blood-forming tissues for this area is leukemia due to malfunctioning of lymph and marrow tissue. So leukemia means you don't have enough that are coming out. Okay, so thyroid, viruses, cortisol, malaria, things like that. So know the difference between leukotosis and leukemia. They will definitely trip you up on those. Development of white blood cells. Alright, and going into the differential white blood cells, okay? So you have your basophils, eosinophils, your lymphocytes, and your monocytes. Monocytes, largest normal white blood cell, muddy and gray. Lymphocytes, clear sky, blue, scanty, with uneven red blues. Neutrophils, they ingest invading bacteria, kind of like your police officers in the body. It's basically your white blood cells, but no, right there, your neutrophils are usually those ones that are responsible for ingesting those and getting rid of them. So, falling white cell count with the number of maturity of neutrophils progressing toward normal indicates recovery. If it starts going down, that's a good sign. I would know that eosinophils, so an increase in those is usually indicative of a parasitic infection. And allergic conditions, so someone who's having an anaphylactic reaction or someone who has very severe allergies, sometimes allergies, if they can't pinpoint what it might be, they'll do that test and they'll see if they have an increase in that because it shows that their allergens are being triggered. Alright, so we're getting into bacteria. So disease producing ability, pathogenic bacteria that causes disease, or non-pathogenic harmless bacteria. There are such things as good bacteria. Alright, so temperature. These are all requirements that you need to grow bacteria. So temperature, kind of areas this bacteria like to grow in. What's the temperature? Warm, moist. Then they need oxygen. They need to be able to have air. And they need something to eat. So, right there, you have examples of bacteria. So know that Coccus is spirally. You have your bacillus, it's rod-shaped, and the screw, which is corkscrew. So. Toxins, okay? Endotoxins and exotoxins. Know the difference between the two. These different common bacteria, I've definitely seen these on there. Specifically regarding what being positive or negative. Gram positive, gram negative, okay? So if you have pneumonia, are you gram what? What about gonorrhea? Okay, so gram staining, gram positive cells retain crystal violet. Violet. So positive, purple. Negative, pink. It'll take 1 minute. So either one or the other. Alright, serology. So getting more into antigens, antibodies, RPR. Okay. Do not be confused with what an RPR is. It's not going to be positive or negative. It's either going to be reactive or non-reactive. I've seen that on the exam. So if it's non-reactive, it's a negative test. It's good. No syphilis for you. So urinalysis. Big thing I know with urinalysis is that number right there, 600 to 2,000 milliliters, averaging 15 milliliters right there. Normal daily urine output. With a 24-hour urine, what are they going to do with that first urine of the morning? Alright, so red or brown means usually you have blood. Yellow brown is bile. What's orange mean? Okay. Then sometimes they can have leukocytes in their urine as well, indicative of what's going on if they have leukocytes in their urine. Okay. Specific gravity. Definitely seen that one. Know that right there down there too, how they measure it. Measure it with an index refractometer. Okay, that's what I want you to pay attention to. Alright, so some of these on here are considered like your emergency reasons. So this is why you would call if you get a lab result back indicative of these things, okay? So white blood cell count above 50,000, hemoglobin below 7. Alright, glucose or ketones both positive on your urine. Red blood cells are not usually present in normal urine, unless what? What kind of patient might have red blood cells in their urine? Okay, rhabdo, what else? What might be normal for this patient?
Dehydration.
Not dehydration. Thank you. Females, all right? You might want to ask her. She's got blood in her urine. Just ask her. Be like, hey, is it your menstrual cycle? All right. Minimum file of 10% for the walking blood bank. Know that right now. 10% on a shit. Walking blood bank. Questions? No. Y'all stand up for a minute. Shake it out. No. Last question of the day.
Quizzes. Just keep doing the quizzes over and over and over, and then just listen to what Agent 2's saying. Seriously, you should do quizzes at least 100 billion times. I know it's hard. So you're like, damn, this shit's dry. But the more you do it, the more you repeat it, you'll be surprised. And you'll take it later, and it'll commit to memory. You can stand here and remember me saying this when you're taking your exam, and you're like, oh, yeah, that's great. Trust me. Weird. Just keep doing it over and over and over. Alright? If you guys don't, if you just continue to stay in this stagnant, I'm tired motion, your test scores aren't going to go up. Just keep doing those quizzes over and over. Even while she's talking, just keep going on the quizzes. Even if you want to go for the quiz for the one prior to this, just keep going through them over and over and over. Don't stop. Alright? Get tired, stand up, walk around, back on the quiz.
Alright, emergency rescue supplies, equipment, and procedures. I'm trying.
No, it's rough, I get it, but, hey, you know, we beat you down with this stuff, but, like John's was saying, just go over and over and over these quizzes, and it will pay dividends, in terms of profile sheet as well as future, advancement study.
Alright.
You get a study. What I'm getting at. You need to study, but it is what it is.
Pretty sure the other class are too, so if you guys aren't over there like standing up, you're wrong. Okay. So, we're gonna go ahead and move into this. I'm gonna really push past this one because emergency medicine should be beat over your head. How many texts do I have? Uno? Dos? Okay. So, you guys might be a little unfamiliar just because you're in a different, depending on whatever your tech capability is. Okay. Alright. Dressings and bandages. Sterile pad. Compressed, used for the wounds. Alright, types of bandages. Big one I want you guys to remember. Barton bandage. And that cravette bandage. Barton bandage is the big one though. I've seen that one so many times. Alright, moving into tourniquets. Alright, so you have your combat application tourniquet, the cat tourniquet.
Hey, Chief wants to push these last classes to Friday. So they're getting tired. I'll take care of them on Friday.
I was gonna say,
You can,
go on Friday, that's Friday.
because you guys, I know you get burned out. And there's, so Friday, we'll just add this stuff on Friday since from only 8:30 to 9. You guys were technically out of here by like 9:30. I'll push this, teach it on Friday, we'll get out of here at like 10:30. Is that cool? Yeah. So you guys can get out of here now and go home and study. Test 3 will be, or test, what are we on, day 2? Test 2 will be in there, make sure you guys are doing it. I don't want to get up in the morning like I did today and see only 13 done. And then you guys are doing them before you come in here. Okay? So make sure you get in there and knock it out tonight, alright? And really go through these quizzes over and over and over again. Got anything, Chief?
Well, I kind of talked to the other class about this, of like, if you were just doing that test for completion, then you're doing it wrong. It should be a knowledge check of, you know, at the end of the night, like 8:30 or whatever, the kids are going to bed, like 10, whatever time that is. You do all the quizzes of the chapters real quick that you did throughout the day, and then you do that test as a knowledge check. If you want to sandbag it, and, you know, I give this speech to a lot of advancement classes, like, if you do not want to study, great. Like, I don't care, because it doesn't affect, like, my paycheck or my career. Like, I really don't give a shit. And, in fact, you are helping those that do want to study. It's that much easier for them to pick up. So, just kind of think of it, like, if you don't want to study, good on you. You're just helping that person next to you that does want to study, and that's who I want to see advance. So, it is what it is. Take this stuff for what it is. At the end of the day, like, we push out the resources. If you don't use them, I don't care. It is what it is. It's not going to affect my pay or my career, but it will affect your career. So, take that for what it is, okay? Cool. All right, bye guys. We'll see you tomorrow. Thank you. I know you have your board on Friday. Let's see if we can work with Johnson to get what time do you want me to?
Yeah, that's what he's working on right now. What we might do is I might just switch with our follows.